Okay, hello everybody. This is AAMI News and Conversation. I'm Brian, and we're here at Sterilization Standards Week 2025. And I've got two representatives from one of our winning committees, the AAMI Technical Award Committee. This is Working Group 61, Horlando Cintron and Alpa Patel. And you guys are the co-chairs of Working Group 61. And gosh, you've been putting in a lot of work. The number one thing that I can think of right away is ST58. But before we dig into that, why don't you tell me what this working group is all about? What does it represent?
It represents disinfection and sterilization in healthcare facilities. It is a user document, so we're providing guidance for the healthcare facilities to perform disinfection and sterilization processes.
Right, excellent. And I had mentioned ST58. So Orlando, this is a document that I hear when you first started as a co-chair, Alpa, possibly you too. This was the project that you just started. We're going to overhaul ST58, which is a really commonly used standard. What was the job there? What was needed to be done?
Well, the job was to bring um, all the advancements that's come to the industry into this document. The document, when we first came on as co-chair, was last revised in 2013.
Oh,
It was well outdated, and I'd say technology had advanced, the processes had advanced, and where we were in sterilization had advanced. And one of the bigger areas that we needed to improve was sterilization modality for flexible endoscopes.
Mm.
And then we went further to add into the document um, ethylene oxide, if you will.
that's a big buzzword that everybody likes to talk about for good reason. It's a very commonly used modality. And then endoscopes itself, also hot topic. ST91 had published not too long before you
Yes.
guys got started on this project. So um, I guess what I want to know is what kind of work went into this. Alpa, we were talking before, it took you 5 years to overhaul
It
this standard?
it took at least 5 years
Yeah.
for Orlando and I to go through the document and update the applicable parts. We had a very technical committee with all technical experts in low sterilization modalities
Absolutely.
and people that are working behind the scenes making these devices. And we also had the user community that was very passionate to ensure that current practices are established in the standard and we're not using the outdated version of it as well. And we had a lot of test labs as well that were trying to bring in new practices on validation assessments as well. So it was a long time for I guess for us, but I feel like we got it done in a sufficient time for publication.
5 years for a major overhaul like this, at least from my experience watching Amy's growth, is that's a very short time. It's an impressive amount, and you got a ton of work done within that time because I'll say it again, this was a huge overhaul for this standard. A lot of people were very excited about it. The news reception on our side was people wanted to know everything and anything about what had changed. So it was good to see. Um, but I'm glad you mentioned the representation because you two, as co-chair, actually are representative of what this committee really looks like. Orlando, you are on the kind of boots on the ground clinical side of things. Is that right?
Absolutely. So, in my role, I not only manage sterile processing department and areas within the operating room, but I'm also president of the New Jersey Healthcare Central Service Association.
Okay.
And so I hear a lot of comments about, we're having these struggles in our facilities. We need updated documents that help support getting this advancement in equipment into our facilities, and how soon is these documents coming out?
Yeah.
And getting all that boots on the ground information really made a difference.
And Alpa, who are you representing?
I'm representing the testing labs that are validating
Hmm.
these flexible endoscopes, the AER, low temperature sterilization modalities. So it was it was it was a document that was well needed for the the manufacturers also to see what they need to validate.
I see.
What are hospital practices being updated to? We need to make sure that the gap has been assessed. And if we need to go over and do more, then how do we do that? And this helps both sectors of the business to combine.
Yeah. And last year, you and I talked a lot about this standard, so I'm not going to do a repeat of that for our viewers. You can look into the description to learn more, but I should say that, are you pleased so far with the release of ST58? Did you get the reception you were hoping for?
Absolutely.
Yeah.
Absolutely. More so, I think Orlando can speak to it because it definitely impacted the healthcare industry more than it did the manufacturers, since it was meant for that. So I'll let him speak to that.
Yeah, absolutely. So I think, another component of it is that the more standards that we look at that are now mandating certification,
Mhm.
training for end users at the front line,
Mm.
this document provided that. And, the positive feedback we're hearing from people that, one is ethylene oxide has not been updated in over 20 years. Now they have something tangible that's up to date, that's giving them that guidance. But we're very well received. I had a seminar that we were a part of, or my group put out there, and we actually gave away the document as a giveaway prize,
Oh,
and
no
the people
kidding.
were
Wow.
really excited. Everyone wanted a ticket. Everyone wanted to know about it, and so it was really, really exciting. Very well received out there, and people are buzzing about it.
That's good. That's good. And although some of that buzz is now resulting in new projects from your group, right? It's not like you're resting on your laurels right now.
No.
Absolutely not.
So let's talk about those. The two TIRs right now that you're working on, technical information reports. One is 121 and one is 118, and those numbers really mean nothing to me right now. So why don't you tell me? Let's start with 118. What is that all about?
118 is about UV disinfection used in healthcare facilities, and it's providing guidance to the healthcare users of how to use the devices and what they should check for validation. Are these devices capable to be used in UV chambers? So because right now there is nothing, and when we were talking previously about is there a need for such document,
Hmm.
we did have the user community saying that, hey, we're seeing nail salon UV
You gotta be kidding me.
devices in the hospital. So yes, we do need something out there to discuss what is acceptable and what is not acceptable
Yeah.
to use in healthcare facilities.
And for clarity, this is not high-level disinfection, right? We're talking about disinfection of other areas.
So it does encompass high-level disinfection as well.
Oh, it does. Okay.
Yes. So some ultrasound probes,
Yeah.
like vaginal probes, they do, because it's a semi-critical devices. They should be high-level disinfected. So they are some for high-level disinfection, but majority of them would be for non-critical devices.
So is the idea that this standard is going to be complementing ST58?
Not necessarily, but I think that post-COVID, UV became very, very popular
Mm.
in healthcare settings. And, the mandate became we needed to find a way to give high-level disinfectant product quicker to end users. And so many facilities started using UV disinfectant, but I think at the front end, what this document is going to do is it's going to give that informational aspect to end users on what they need to know about UV disinfectant, give them the opportunity to understand that there are areas where it is safe to use, but then there are some precautions that you really need to take on
Right.
and understand when you're moving with UV disinfection.
Okay. It sounds like there's a lot of work there. Is there a call to action to have anybody participate? Are you looking for more people to join this group?
We are welcoming anybody who wants to join the group. We do have manufacturers of UV disinfectors. We do have a huge user community that is participating in
That's
there as
great to
well.
hear that
So
the manufacturers are already at the
They're
table. That's
manufacturers at
good.
the table, and there's a
Yeah.
lot of technical expertise in the group as well that is helping write some technical aspect of it as well. So it has been so far very satisfying to see that we have a good representation of all sectors participating, but we're always looking for more people that have information on UV and
Right.
would like to bring that to the attention to this group.
And you both were working through comments today or yesterday about
Yesterday.
that standard. Is that
Yes.
correct? Yeah.
That is correct.
But you got it all done.
We had 161 comments on it.
Wow.
It was user comments, regulatory comments, AORN, APIC,
Mhm.
HSBA. We had a comprehensive group, and we're able to successfully get through all of those comments within a day. I got to say, thanks to the good push of my friend Alpa, who really is a driving
We're gonna get
force.
this
You
done.
know,
Yeah.
she really knows how to, amplify the team and
Oh, that's great.
make it work, and still do so with a lot of laughs, I might add. It was an enjoyable working group, I must add.
I love hearing that because I feel like a lot of people who are on the outside looking in for standards development might imagine that it's either a room full of arguing people or a room full of scientists just nitpicking details, but that's not really the case, is it?
No, not really. I mean, to a certain degree, we do have the scientists that definitely have opinions, I might add, but we also have a larger working group, and I think the respect and the
synergy.
the synergy that we really provide one another is really, really outstanding within the working group. But then we also have those that are online as well. I mean, technology changed that, so it's not just who's in the room;
Yeah.
it's those who can't make it and are still a part of it, and maybe can't leave work, but can be a part of it and can participate and can make sure that their voices are heard. So I think that's a very good thing that we saw during COVID this year.
Well, that's great. And
Yeah,
you know what?
post-COVID.
If anybody wants to be involved in these kinds of conversations and get involved in TIR 118, they can reach out to standards@aami.org and we will get you connected. But let's talk about the other projects because this is an even newer one, right? 121 is kind of fresh off the block. What's it all
is.
about?
So TRI 121 is about cleaning and disinfection for patient care items that are in healthcare facility. Now, patient care items would be devices that are put into patient rooms.
Oh,
So it is now we're looking at a different aspect
yeah.
of healthcare facility, and a lot of those devices are neglected. Right, they are hospital practices for it, but are those practices appropriate or not?
Hmm.
And during the APEC, what was it, survey that they did last year, they did see that non-critical devices, which that's what it is in the patient rooms, they're seeing healthcare acquired infections increase in that area. So are we doing it
Oh,
correctly or not? Or
yeah.
what is the routine? What should we be doing? And so this document is going to address all of that information.
I can imagine some of these devices fall into some very gray areas, say like it's a gaming device for patient therapy or something of that nature. Can you
Yeah.
give me some examples of what these devices are?
These devices would be where we're tackling bed pull, where they have their saline. We're
Oh,
looking at devices that are monitoring devices for the patient.
Correct.
We're also looking at wearables that are
like a VR headset,
Yes,
for instance.
yeah,
I see.
that are given to patients. We're also looking at mattress pads and anything that's in a patient room you can imagine
Yeah.
that needs to be disinfected before another patient comes in, is what we're tackling with.
Gosh, that's a very wide scope because I'm sure it touches on multiple hospital departments. Is that right?
Absolutely,
Yeah.
but it's also engaged at any piece of equipment that's used in that healthcare setting. We really need to provide additional guidance. We do a very good job at managing critical care areas,
Mhm.
and we did see that post COVID when equipment became, not available. We were having a hard time getting new equipment onboarded. We see increased patients coming into our space, and we're finding that we don't have enough equipment to just send to a central location to be cleaned and then brought back up. And now we started doing this cleaning within those patient care area rooms and not providing the additional education and training for that frontline staff. And so this is going to provide end users that opportunity to have a better understanding at what are the risks and what are the things that need to be inspected prior to using on that next patient. So a very good and critical component that is absent right now, if you will.
Yeah. This sounds like very important work. And again, if people want to get involved in the work with TIR 121, that sounds like you can reach out to standards@aami.org and we'll get you connected. But
Absolutely. And we can definitely use more frontline users that want to get involved, have run across some challenges, and understanding what those challenges are for everyone
Yeah.
is really what we want to make sure we're addressing. So if you have some involvement and knowledge, please reach out to AAMI.org and, provide your name, and we look forward to having you on our group.
I should note, Alpa and Horlando, you both sacrificed your lunch break to be here today, so I appreciate that. And congratulations again for winning the AAMI Technical Committee
Thank you.
Award for 2025.
Thank you.
Very well deserved. Very
Thank
well
you.
deserved.
Thank you.
So thanks for joining me.
Thank you.
Thank you.
All righty.